we're going to get started in emergency back position. This involves you placing your knees up on a chair so that your knees and hips are both bent at a 90-degree angle. In this position, imagine the flat of your back pressing into the floor as gravity starts to get heavier and heavier to flatten that space. As your palms are faced up towards the ceiling, take deep belly breaths in for 4 seconds and out for 4 seconds. Continue to breathe in through your nose and out. Place one hand on your belly and your other hand on your sternum to make sure that your hand that's over top of your stomach is moving up and down with very minimal movement occurring at the chest. 80 to 90% of the movement should be occurring at the belly. The last 20 to 10% is your sternum. Now again, relax both arms by your side, palms up towards the ceiling. Breathing in deep, exhaling for 4 seconds. Repeat this process, drawing attention to your breathing. With every exhale, your back pain is decreasing and leaving your body. Gravity is getting heavier and heavier, and the curve in your lower back is flattening more and more into the floor. Now, move your arms out as if you're going to do a snow angel to the side. Your wrists should be just above shoulder height to open up your chest. Keep breathing in for 4 seconds and out for 4 seconds. Maintain focus on the upward and downward motion of the belly. Very little movement in the chest. Now try to finish the snow angel and reach your arms elbow straight up to the top with your arms by your ears. Maintain the breath of inhalation and exhalation in a calm, controlled manner. Breathing with your belly up for 4 seconds. And exhale for 4. With every exhale, the pain in your low back lessens as you feel your spine stretch from the top of your head to your tailbone. Your low back keeps pressing flatter and flatter into the floor. As you continue to inhale and exhale for 4, Keep your shoulders and shoulder blades relaxed. Elbows straight, palms facing up towards the ceiling. Relax the back of your neck, your face, your eyebrows, your eyelids, your mouth, and your jaw. There should be no tension in your body right now. Begin to clasp your hands. Press your index fingers together to form a 1. Keep inhalating and exhalating in a controlled manner. Now slowly and controlled, begin to move your arms so your wrists are above your shoulders over your head. As you inhale, place them back down on the floor. Hold your breath for 4. And as you exhale, recover them back to the starting position. Wrists above your shoulders, and hold your breath for 4. You will inhale for 4, hold for 4 at the bottom, and when you recover, exhale for 4 seconds and hold for 4. Repeat this process. As your arms begin to lower towards the floor, and you inhale, maintain the contact with your lower back on the floor. And as you recover, keep your shoulder blades relaxed, elbows straight, palms of your hands together, and index fingers pressed together as well. Maintain continuing this process, focusing on keeping your back flat to the floor, shoulders relaxed, elbows straight, and hands pressed together. Every time you're pressing your hands towards the floor, reach a little bit further to stretch your spine even more. Now recover, your palms up towards the ceiling. Begin to move your feet and straighten your knees to prepare yourself for the next motion. As we will be changing positions, make sure your pelvis and your lower back feel stable to do so. If it is, gently and slowly shift both your feet down towards the chair beside you and shift yourself back up. Now this motion I'm doing right here might be too extreme for you, so do what's in your limit. Now gently twist both knees out towards your left side. Keep your core tight and recover back to a neutral position. Feet should be flat on the floor, and the controlled motion of your knees now towards the right, as you're allowing that twist to occur in your tailbone, your lower back, and your hips. Now inhale or exhale when you go to the side. And as you inhale, recover back to a neutral position. Hold for 4. Exhale for 4. Twist to your right. Hold for 4. Recover back to center as you inhale. Exhale, twist to your left. Now start to move your head to the right, the opposite side of your knees. Inhale, move your knees and head back to the center. Hold. Twist your knees to the right. Now look to the left. Recover both your head and your knees towards the center. Repeat this again. Look to the right, knees to the left. As you exhale. Inhale, knees and head back in alignment. Exhale, twist knees to the right, head to the left. Recover back to center. Now only use your right leg to let your knee fall in as you stretch your knee out straight. Now come back in the same way you went over with your knee going towards. Let your knee fall out to the side. Straighten your leg. Let your knee fall out to the side as you're bringing it back to a bent position. That's one, and repeat. Knee falls in as you straighten your leg towards the floor. Knee falls back in as you begin to bend. Knee falls out as you begin to straighten. And when you begin to straighten or bend again, falls out to the side. Repeat this process a total of 5 times. Remember to keep focusing on your breathing. Keep your left leg that's stable and straight in alignment and try to do minimal movement to start working on the core. Bending your knee out to the side and back straight. Let it fall in. Straighten your leg. Bend, knee back in. And let your knee fall out to the side. Straighten it. Bend it with your knee going back out toward the side. And back to center. Keep your upper body relaxed. Eyebrows and face, mouth, tongue, jaw, all relaxed. As you repeat this figure 8 movement. Now, repeat this motion on your left side for your left hip. This will also help the movement of your sacral iliac joint. Let your knee fall out to the side. Straighten it. Slowly and controlled. And as you begin to bend it, your knee will fall out towards the side and back to a neutral position. Continue letting your knee fall inward as you straighten it and bend and let your knee fall out towards the side. Now keep your right leg stable. Try to get very minimal movement within your upper body and let the movement happen in your hip and sacroiliac joints and lower back. Don't forget to inhale and exhale in a synchronized movement with the pattern of your leg. Bend as the knee falls inward, and let the knee fall out. Straighten and recover back towards the center. Repeat again. Now place both your hands on the points of your hips and start to curve your pelvis in and out. Squeezing your glutes to tuck your pelvis up and rotate it up towards the ceiling. And rotate it back the opposite way. This will focus on the bending forward and bending back of your lower back in a controlled manner. It is important that the spine can move in all ranges of motion. Otherwise, pain will result from lack of mobility. Continue this tilting back and tilting forward of the pelvis. Don't forget about your breathing. Inhale and exhale, matching the movements. Inhale as you begin to stick your butt out, and exhale as you tilt your pelvis and pubic bone towards your sternum. Now again, place your hands together above you and clasp your hands, making a one. Stretch it up and over. Imagine your spine lengthening. And bring your arms up again, wrists above your elbows. Repeat the pattern as you did when the feet were in a 90-90 position on the chair. Exhale at this moment and hold for 4. And as your arms travel towards the floor, inhale and hold for 4, lengthening your spine each time. Remember in that position and throughout this position to maintain contact of your lower back to the floor. Let gravity win and flatten your spine against the floor. With every exhale, the pain is leaving your body. Your shoulders are relaxed, your elbows are straight, your face is relaxed, your neck is relaxed, your eyelids, your mouth, your tongue, your jaw. Now gently roll to your left side and push yourself up to keep your back nice and straight. If you can, go onto all fours. If this is not an option for you, continue on your back. This movement here is known as cat and camel. You want to try to get movement equally from forward bending to extending like so. In this position, it's important to try to press your shoulder blades away from each other and curve as much as you can. And here, try to lift your chin up towards the ceiling and press your shoulder blades towards your tailbone. Press your shoulders away, making sure to try to focus on curving in that pelvis. Remember that movement we are practicing with the lower body on the floor, tilting our hips and pelvis, tucking in and tucking out. That movement was to prepare us for this bigger movement of our whole entire spine. Continue to complete 10 rounds, tucking your chin towards your chest, making sure the lower back and pelvis are tucking as well. Now extend and bend your spine to create a C, lifting your chin towards the ceiling. Tuck. Press your shoulder blades apart, chin towards your chest. And up. Don't forget to breathe. Inhale or exhale. And as you go into this position here, begin to inhale for an extra stretch. If that is uncomfortable for you, you can also inhale at this point as opposed to exhaling. And now exhale, so it's not as much of a strain. We'll now finish with our legs crossed, making sure to keep our back straight, moving carefully towards the next position. Palms up towards the ceiling, forearms resting on the knees. Take as long as you need here and focus on your breathing. Inhale for 4 and exhale for 4. Inhale for 4 and exhale